All right, can you all hear me? And thank you very much for scooching in and being close. So we're going to build on a lot of what we heard this morning. We have some AV issues. We're going to work through that. But, you know, we have plan A, B, C, right? So we're going to just keep going up to Z. A lot of what you're going to hear may sound like a repeat, but that's because we're going to reinforce for you. So this workshop is going to reinforce and hopefully add to some of your skills. What is different is that if you want, and only if you want, you can practice in front of your peers. You do not have to. I have a lot of exercises you're going to do in the privacy of your own pad of paper, but if you'd like to practice some of these skills in front of the group, you'll have that opportunity. Oh, you're filming me? Yeah. I didn't sign the release, though. I'm just kidding. I signed my release now. Okay, so no walking and talking. So let me reassure you about safety. This is a zone, God bless you, of safety. No one will be asked to share or do anything they don't want to do. I don't want anybody to be on the spot. Public speaking is one of those things that most people have panic attacks about. In fact, if you're not worried about public speaking, it's kind of not normal, right? How many of you love public speaking? Good, good. So you guys will be state reps. We'll be doing a special workshop just for you. Now, I want to assure you that I'm up here because I have some experience doing this, but I am by no means an expert. I just have a lot of experience, which is what that means is I've made every mistake in the book on live TV. I've gone blank on Good Morning America standing next to Sally Field. All right, not a good look for anybody. I have had my hair in disarray. I've had stuff in my teeth. I have made every mistake in the book, and I'm still standing here. I'm still talking to you, so I didn't die, although it feels like you're going to in the moment. I just want you to know that I'm always learning. I get media coaching regularly to do what I do. And I'm always picking up hints and tips when I watch the news or when I watch somebody give a talk. So there's always something that we can learn. So while we work on this, what I'd like for all of you to do is take your pad of paper and you're gonna make it into 4 quadrants. You make a line down the middle and a line down the side. So in the middle, both ways. Right, so we're gonna divide the piece of paper into 4 equal parts, or as equal as you can get them. What I'd like you to do in the upper left-hand part is I'd like you to just write down a few words about how you think your friends and your family would describe you based on either what you're wearing today or what you normally wear, or how you normally present yourself. How would they describe you? And use words like confident, klutzy, pulled together, rushed, other words, warm, caring, approachable. Whatever words, how would your friends and family describe you as a person based on kind of what you're wearing, how you walk into a room? So I want you to take a moment and just write down a couple of those words. I want you to think, if any of you have any experience as a nurse with patients, I want you to also write down how do you... Whoa. Okay, so I live in earthquake country, so I'm like, where's the door? Scary. Okay, people would describe you as scared, wetting your pants, right, so how would patients describe you? Even if you were wearing scrubs, I bet when you were at work you had some way of individualizing. You wore your hair in a certain way, maybe you had something dangling from your stethoscope, maybe it's the kind of pens that you brought. I want you to think about what's kind of individual about you. Is it your hairstyle? Is it your glasses? Is it the jewelry that you wear? I want you to pick out one thing, or two things, or three things that make you you. What do your friends or family say? They say, oh, she always carrying those really nice designer handbags. Whatever it is, okay? And I want you to just hold on to that. We're going to do the best we can with these slides. Here's my disclosures, here's my objectives. So I want you to all be flexible. It's not, we all have challenges, look at it. It's not the fact that we have a challenge, it's how we deal with them, right? What you're writing down is your brand. You have a brand, whether you know it or not, you have a brand. And I hope you can see this. Here's some branding examples. Do you all know who these ladies are? The Kardashians. Anybody not know who they are? Diane, do you know who they are? No, she does not know who they are. Somebody help her with Pop Culture 101.
You're lucky.
You're lucky. All right, do these ladies have a brand? Is it pretty consistent? I'd kill for those eyebrows, wouldn't you? All right, these ladies have a brand. Now look at these ladies. Do you know who those are? Our Supreme Court justices. Do they have a brand? Are they instantly recognizable? Those are the Kardashians. On top of them. Those are called branding examples. Everybody in here probably has something with a brand. If you wear Nike shoes, you know what the little logo is. Apple, the Apple logo. That logo is their brand, but you have a brand. Why am I talking about this? Because when you walk into a room to see a patient, they are making a snap judgment about you in about a third of a second. So you already have a brand. And you probably made a snap judgment about me, right? When you saw me today, am I going to listen to this person based on how I look, how I appear, how I comport myself? We all have a brand, and oftentimes we're blissfully unaware of the messages we're sending when we walk into a room without saying a word. So that is what we're going to talk about today. When you think about the Kardashians or the Supreme Court justices, I want you guys to shout it out. What are the Kardashians? What do they communicate with their brand? Just shout out a word.
Glamour.
Rich.
Glamour. Glamour.
Glamour. Sexy. How about got some big. Me, I am Mama Mia. What else do the Kardashians? Tight clothes, jet set. What else? Money. What else? Fame. Vanity. Superficial. Do any of you watch that show?
They are.
All right, what do they do on that show? Nothing. If you get past that, though, there's a lot more to Thank you for saying that. So don't judge a book by its cover. There's a lot more to them. If we want to, we could look below the surface. Chloe got her PhD in microbiology, but you didn't know that. No, I'm just kidding. Here's some branding examples of nurses from the past and nurses now, nurse practitioners now. Right? So we have, I actually went to nursing school where they had the hats, and my class, I was giving my graduation speech, go figure, right? I had to talk to my dean. I said, we're not wearing the hats. That was the first year. Nobody wore their hat. I mean, I'm a groundbreaker. I just want you to know that I'm a groundbreaker, so none of you have to wear those hats. All right, so here's more examples of branding and your image. Okay? All right, can you see these pictures? What do they say? Okay, so let's look at Reese Witherspoon as Legally Blonde. What does she say? What does her image say? Just tell me.
Hi guys, you like my bag?
You like my bag? Okay. All right, raise your hand so I can call on you. What is her, the pink, the one in pink, what does it say? Feminine. What else?
Friendly and approachable.
Friendly and approachable. What else? Put together. She's put together. She likes pink. What else? Optimistic and optimistic and in the picture, optimistic, and she's cheerful. She's cheerful. All right, what about Melissa McCarthy from Bridesmaids? What does she say?
Don't bother me.
Don't bother me. What else? What? Get away. What else? I could kick your butt if I had to. What else?
Why are you looking at me?
Why are you looking at me? Does she seem happy? Does she seem approachable? No. Well, she's put together, she's wearing her pearls, she's making a little bit of an effort. And what about Rooney Mara, who was in, that's the girl with the dragon tattoo. What does her image say? Dark, intense, what else? Fierce, unapproachable. What else does her image say? I know it's really hard to see, thank you.
She's guarded.
Guarded, guarded. She probably has some walls up because she might have been hurt in the past, which if you read the book, you know she's been hurt in the past. So she's saying, stay away. Now, if the lady on the far right or the lady in the middle walked into an exam room and said, hi, I'm your nurse practitioner, what would you think?
Oh, no.
You're laughing. You have colleagues who dress like this. You have colleagues who dress like this, not just for exam rooms, but at conferences. You have colleagues who dress like this. I am sure some of you have seen colleagues who dress like this. Have you? Anybody? Mm-hmm. Do you want them taking care of your elderly mother? Not necessarily. I did not believe this. I did not believe this until I started working with the media team, and they said to me, Barb, people make a decision about you before you ever open your mouth. I said, no, they don't. They're going to wait to hear all this brilliance that comes out of my mouth. No. Once they look at you and they see if they like you, then they'll listen. I didn't believe it until they made me get my hair done. And guess what? People listen to me in a different way. Yes. I had to pluck my eyebrows too, and that was painful. What I'm telling you is that I didn't believe it. I thought that it was what came out of my mouth. But once I started dressing the part, started dressing for the image I wanted to convey, people took me more seriously. I didn't grow up with a mother who taught me how to dress. I did not know that. So I was always very unkempt and a little disheveled and always rushing, and I didn't iron my pants and all the rest of it. And it makes a difference for how people perceive you. It takes an awful lot of brilliance to get past that. So I'm just saying, for me, I had to learn the hard way. So, let's see. How would people describe you? Now, what I'd like you to do is on your piece of paper, below that, on the bottom, let's see, left hand, what I'd like you to do is write down who you like. It could be a colleague, it could be somebody in the news, it could be a celebrity. I want you to think about your professional and sort of celebrity aspirational icons, the people you want to dress like or be like, or emulate when you walk into that room. Hi, I'm your nurse practitioner. So just take a moment. This is private. You don't have to share this. Who do you want to emulate? It could be one of your supervisors at work already. It could be a teacher you knew as a kid. It could be a neighbor, somebody who's put together. It could be a political figure. It could be anybody. But I'd like you to think about who your style professional icons are. So, you want to guess who mine is? Jackie Kennedy, right? Right? I'm trying to be like Mrs. Kennedy. I was alive when President Kennedy was shot, so I know, I'm old. I'm so old. So when you write down that person, for you, and it could be anybody, it could be, does anybody want to share who theirs are? Does anybody feel brave to share who theirs are?
Michelle Obama.
Michelle.
Yeah.
Oh, I'd give anything for those arms. Michelle Obama, she's beautiful, and she's a beautiful style icon. And you could wear anything she wore to the convention under a lab coat. You notice I'm wearing a sheath dress. Looks good under a lab coat. You don't have to spend a fortune. You can buy these kind of dresses anywhere. And they look put together, instantaneous. If you're a man, shirt and tie, loving it. Love it. Anything with the collars looking good. Anybody else want to share their style icon? Katie Couric. She's great. That's another thing. When you're thinking about how you want to be perceived, look at morning news anchors. Morning news anchors typically wear solids that look great on your lab coat, and they wear layers. And so shirt and collar, you don't have to spend a fortune. You can buy this at Kmart or Walmart. You can buy a nice collared shirt with a sweater, a skirt, or slacks. You are put together, and when you walk into the room, hi, I'm your nurse practitioner. Guess what? Credibility. Instantaneous credibility. But if you do walk in looking like Melissa McCarthy from that, why would I listen to her? Remember, you have to know your audience. Why would I listen to her? This doesn't mean get rid of your individuality. You find ways to put your individuality into what you wear. What I do is I wear really nice shoes, and I buy them at discounted DSW, and I get them online when they're on super extra special, 70% off extra sale, because I don't want to spend my money on good shoes. I want them, but I don't want to spend my money on them. Now, the next thing I want you to think about, and you don't have to share this, and I'm not going to ask anybody. I want you to just take a quick survey of yourself. And I want you to look at what you've got on today. Is this enhancing, so positive, is this enhancing or detracting from what I want to communicate? Is there anything you're doing that's, hey, I'm rocking it. I'm put together, this is how I want to be perceived, and it's good, I'm enhancing this aura of credibility, or is there anything I maybe should tweak a little? All right, I don't see you guys writing that down. Which box? Any box. You could, bottom, I don't know. Just take a moment and say, now, one of the things I do is my clothes often are too tight. I wear clothes that are too tight, so I got some Spanx, so I could look better. So there's a lot of things that you can really look at, because your appearance matters and professionalism matters. Because guess what? I represent all of you when I'm on TV. I represent 200,000 nurse practitioners every time I'm on TV. I take very seriously my responsibility to you and to you and to you and to you, because I'm representing you. And when I open my mouth on television as Barbara Dehn, nurse practitioner, I want you to be proud of me, because I'm representing you. And when you walk into a room with a patient, I'm not there, but I want to be proud of you. I want to know that when you walk in, that your patient's going, well, hey, I saw a nurse practitioner on TV. I trust this person, and look at this person here. This person is warm, they're credible, they're intelligent, they can help me. So, take a look at your brand now. Just take a look. Is this communicating what you want? Now, you notice I'm not telling you what to communicate. Did you notice that? You decide what you want to communicate. And I apologize, are you communicating knowledge, passion about your subject, caring, warmth, credibility? Are you communicating that you're organized, that you're professional? Even how you walk into the room. Hi, I'm Barb, I'm your nurse practitioner. I'm just gonna wash my hands here while we talk. How have you been? What's going on for you? What brings you in today? What am I communicating with everything I do? If I run in, oh my God, that goddamn patient driving me up the wall. What are you hearing? Right? That happens. I'm not making this up. It happens. Don't go in. Some of you are nodding your heads, right? Because you've seen it. Maybe you're preceptors. I hope not. Remember, your patients are watching every single thing you do. They are listening and they're watching. And they're noticing, just like when you go to see your healthcare provider, aren't you watching? Did they wash their hands? Are those instruments look clean? You're noticing, right? So are your patients. All right. So this is hard to read, so I'm just going to say it. It's 20% how you say something. It's 80% how you say it. 20% how. What? 20% what? I have to screw that up. 20% what? 80% how. So if you say to your patient, I really want you to take these meds every day, versus, I would feel so much better knowing that you were taking your medicine every day because I worry about you. It's a very different message, right? All right. Now, we're not calling anybody out, but I want you to look around at your neighbors and look around this room. Who do you want taking care of you when you're sick? Who do you want taking care of your mother? I want myself, I know. You want yourself. But look around. Who do you want taking care of you? You don't have to write it down. Now let's switch gears. Should we switch gears? Okay. Oh, you can't see this. It's a shame. No one knows how much you care. No one cares how much you know until they know how much you care. No one cares how much you know until they know how much you care. That is key for you as a DMP. You can have an encyclopedic knowledge of everything under the sun, but if you don't care about your patients and you don't connect, like we talked about today, Dr. Newman's theory of connectedness and consciousness, you might as well be talking to a wall. Patients want to know that you care. There's a lot of things that you'll learn in this process. Let me give you a few hints. Write down your patient's kids' names. How's Joey? How's Susie? How's your husband, Sam? Oh, I'm sorry to hear that your pet died. Oh, Fluffy was such a great cat. I'm sorry, that meant a lot to you. Write it down, put it somewhere so that you can connect with your patient. The number one thing is to write their kids' names down. Unless they have 25, then just say, well, how are the older ones? Now, I want to say something. You are already an expert at what I'm going to tell you. You guys are already experts here. If you're a nurse, you're already an expert at communication, but let's just enhance it. Let's do what the chef from New Orleans, Emerald. Bam, let's just make it better, okay? Let's make it better. Let's take your communication skills to a whole nother level. You remember the A factor, know your audience, 2 ears, communication 101. How many of you have heard about motivational interviewing? How many of you use it? How many of you find it frustrating as all get out? For me, because I'm a talker, I gotta bite my tongue. For those of you who don't know, motivational interviewing is it is one of the most effective communication tools you will ever have. In a nutshell, motivational interviewing is not me saying, Diane, stop having 5 ice cream sandwiches every night after dinner. This is a true story from one of my patients. Motivational interviewing is, Diane, what would it look like to eat less after dinner? What might you suggest? The patient in question, not Diane, my patient said, well, I could go from 6 to 5 ice cream sandwiches. Oh, that's great. That's great. If your patient suggests it, they are more likely to do it than if you tell them. How many of you have had that experience? Right? Nobody likes to be told what to do. Do you like to be told what to do? No. Why are we as healthcare providers surprised that when we say to somebody, you know, you really got to quit smoking? Do you think that's the first time they've heard that? No. What would it look like for you to decrease your smoking? How would that seem for you? What would that look like? It's really hard because you have so much information you want to give them. But remember, hardly anybody is motivated by information. They're motivated by what motivates them. So what would you like to accomplish in your life? What would you like to do? Are there some good reasons why you might want to quit smoking? What are some good reasons? Well, I really don't want to quit. My family's telling me to quit. Okay. Do you have any motivation to quit? Is there anything about stopping or decreasing that sounds appealing to you? They might say, well, you know, I guess I could smoke outside. Well, there you go. Oh, well, that's great, because then we're decreasing the risk of SIDS for any babies in the house. We let people, we work with people, we empower them, we don't talk at them, we work with them, and we use our 2 ears to listen so we know what their motivations are. When you're with patients, you want to be 100% focused and present. How many of you have done a mindfulness class? Great, so you know about being focused and present. If you haven't done a class, think about taking a mindfulness class so you can talk to your patients about it. A lot of people have anxiety in this country. A lot of people are depressed. The statistics are alarming. We have brought mindfulness into our toolbox. It's a non-pharmacogenetic way of helping people manage their anxiety, even if they're only managing their anxiety for 30 seconds. If you learn how to pause and breathe yourself, you can be 100% laser focused with a patient. What does that mean? It means that even though you have a waiting room full of people and 500 labs to review and 75 prescriptions to fill, and you know in the next room there's a crying baby, it doesn't matter. You are laser focused on that patient at that time. And that's what makes a connection. Because every patient wants to be heard. And when you hear somebody, when you really listen, and you're 100% focused on that patient, what happens? They feel cared for. They feel that they're important to you. And then, now you have this beautiful dance, you have this beautiful partnership. So listening, being 100% present. I know you have a million things back here. Try to turn it off as best you can and be 100% focused on that person. And those of you who pray, That's the same thing. If you know how to pray, you know how to do mindfulness. Basically, you're stepping outside yourself and you're being 100% present to that patient. When you do that, people feel recognized. And when I say recognize, what that means is a lot of people go through their lives every day and they don't think people see them for who they are. But you have this beautiful opportunity to connect on a different level. And your patients will follow you everywhere. Don't you find that, Diane? You have patients from all over the world? I have a patient who flies in from Shanghai. I just saw her. She flew in from Shanghai to see me. That's crazy. There's doctors in Shanghai. There's nurse practitioners in Shanghai, but she came to see me. So you're going to use these same skills. Now when it's your turn to talk, now you've done all this listening, you're 100% present, you're amazing. How many of you have heard about an elevator pitch? Any of you? All right, elevator pitch. It is not just about selling a car or a widget. An elevator pitch is talking to somebody and getting your point across in the time it takes to ride an elevator up 10 stories. All right? And basically, an elevator pitch just means, hi, I'm your nurse practitioner. I've looked at these labs. I've got some concerns. Let's talk about them. Right? It's getting to the point very, very quickly, concisely, and not rambling on and on and on. I mean, in today's healthcare world, we don't have a lot of time. So if you're trying to affect change, if you're working on full practice authority, you have to develop an elevator pitch. So when you're developing an elevator pitch, goes back to what we were talking about earlier. If you're affecting change, why should they care? What's in it for me? And you want to also do the call to action. So let's practice something now, okay? You can either turn your paper over. What we're going to do now is you're going to be asked this question for the rest of your life. So let's start today. What's a DNP? What is a DNP? All right, so what I would like you to write down is some of the attributes. What is a DNP? Is your patient's going to, what's a DNP? You have an example here which unfortunately you cannot read, so I'm going to read it to you. Hi, I'm a nurse practitioner. I love taking care of women. In fact, I've been an NP for over 25 years, and I also teach at Stanford. When I mention Stanford, boom, instant credibility. Hi, I'm a nurse practitioner. I went to University of Tennessee just down the street. Oh, she went to University of Tennessee. Oh, okay, well, I'm going to pay attention to her. Or him, pardon me. I apologize. As an NP, I like partnering with my patients first by listening to what's important to them and then using my education and experience to examine, diagnose, and then offer prescribed treatments and medications to help them with their health. Now that's a long-winded thing, but this comes directly from the American Association of Nurse Practitioners. But I want you to remember 3 words and I'd like you to write them down. When somebody says, what's a DNP? What do you do? How are you different from a doctor? You never start off by saying, well, doctors go to school for 4 years and then they do a residency. You don't do that. You say, well, we're more alike than different. This is good stuff, guys. We're more alike than different. As a DNP or as a nurse practitioner, I examine, diagnose, prescribe, and treat. We're more alike than different. Let me tell you what I do. Examine, diagnose, prescribe, and treat, right? You got it, and that's quick. And then you can move on, and if they ask more questions, you can answer them. It's very important that you develop an elevator pitch about who you are and where you work, because if you're a student, you're going to be introducing yourself. DNP student from the University of Tennessee. I'm here to help you. What is a DNP? So let's start writing that down. You don't have to share it. But let's do this. Raise your hand and just shout out, or raise your hand, I'll call on you. Do you have advanced education? You have advanced, I'm a DNP. We have advanced education and training. Most of us, I'm just going to throw this out, most of us are masters or have a doctorate. If you were a nurse, you could say, I was a nurse and then I went on for added education. How long is the DNP program here? Is it 3 years? This is a graduate, I'm in graduate school for 3 years because I believe the more I know, the better I can take care of you. You don't have to come up with your final elevator pitch or your answer today, and especially those of you who are just day 2 or day 3, welcome. But think about how you're going to introduce yourself and you can practice this with your family and your friends, but the best people to practice with are 3rd graders. 3rd graders are the best because they ask questions. When you slide into jargon, they're going to go, well, what's that? What's epidemiology? I don't know what that is. So, I'm a nurse anesthetist. Oh, anesthetist, what's that? I help people who are having surgery so they don't feel pain. You can elevate your language, you can go up to a different level depending on know your audience, but practice getting it really simplified so that then you can come back and make it more complicated. So here's another one that you can use, and I'll send this to Dr. Pace. Nurse practitioners are expert clinicians with advanced training who provide primary, acute, and specialty healthcare services. We order, perform, and interpret diagnostic tests. We diagnose and treat both acute and chronic conditions such as diabetes, high blood pressure. We don't say hypertension. We use words that people know. And I will send this to you. So anybody want to practice saying what a DNP is? Anybody, any brave soul who wants to come up here and say in front of their colleagues, what is a DNP? And please no first day students. Does anybody want to practice? This is your chance. All right, come on down.
Good.
Yay! And we're going to go easy on her. We're not critiquing. Only positive feedback. Only positive feedback. Okay? Hi, what's your name?
Pam Lucas.
Hi, Pam Lucas. Nice to meet you. You look very put together.
Thank you.
Good to see you. You look warm and approachable. Hi.
Here.
Oh, thank you, Diane. So, how do you want this to be? I'm a patient. I'm CNN. I'm Good Morning America, and I'm asking you, what is a DNP?
Okay. I guess CNN.
I did on CNN.
ISIS has just bombed another country, and now Pam Lucas here to talk to us a little bit about DNPs. Doctor of nurse practitioner, what is that? Are you a doctor? Are you a nurse? What? Can you help our viewers at home?
Okay. DNP is doctorate nursing practice, and we already have our masters most of the time, advanced practice nurse practitioner. And when you go on to become a DNP, what you're really looking for is the understanding that we can work with healthcare systems to make real changes, not just at the clinical setting, but actually moving into a more bigger setting, healthcare systems where we can change
I think you did, Pam. I think you did a great job.
Yes.
You did a great job. Anybody else? CNN, NBC, Good Morning America. Anybody? No? We have somebody else? What is a DNP? What about to a patient? Does anyone want to practice? Well, what is a DNP? What do you do? Okay, come on down. Is there somebody raise their hand? You're just fixing your hair. There's a lot of people over here. I think I see it.
Oh, we have one over here.
We do? Oh, okay, thank you. All right, I'm your patient.
Patient's mom.
I'm your patient's mom. Thank you.
I am a pediatric practitioner.
My son. No, we've always seen doctors, so I'm a little, what is a DNP?
So I am advanced educated nurse practitioner. I did my training at UCLA for my master's, and now I'm a doctor prepared at University of Tennessee. And I'll be taking care of your child, hopefully from infancy to young adulthood, and making that transition, examining, prescribing, treating, and educating you on anticipatory guidance, and making your child healthy.
Wow. Well, that sounds great. That was great. I'd see her. I'd let my son see her. He'd love to see you. All right, come on. We got
Come on,
time
y'all.
for one more. Now come on down. Is there someone who's working on practice authority who wants to? How about over here? All right. Is there anybody else who wants to practice? Because we have time. This is what are we talking about? Am I a patient? No, it's you. Well, how do you want to describe who you are?
I like to describe who I am to the patient.
You know, I don't feel very well today. Thank you so much for working me in today. Now, I usually see Dr. Jones. I understand you're also a doctor, but you're not a doctor, a nurse practitioner. I'm confused. Help me.
Well, my name is Portia.
Hi,
I'm a
Portia.
nurse practitioner student. Actually, I go to school at the University of Tennessee Health Science Center. And I understand that you see Dr. Jones. I understand that you see Dr. Jones. I actually work very closely with Dr. Jones. It's actually kind of a relationship that I have with him, so I will be following up on everything that we talk about with him so that in the future he can continue your care. But I am what you call a DNP, which is a doctor of nursing practice. I do have a doctoral degree, but my license is as a nurse practitioner. So I'm able to examine you, diagnose you, and treat you just like Dr. Jones. And then I work closely with him too to make sure that we're doing what's best for you. But please be reassured that you're under the best care.
That was awesome. Who else? You know, you're probably picking up things from your colleagues, from your volunteers. You're picking up things. Think about the things that you're hearing that you can also use. This is called cribbing, stealing, whatever. Oh, I know you. I met you at AANP.
Yes.
At Dr. Mike's induction. Oh, it's so nice to see you. Oh, nice to see you. Full practice authority. All right, and I'm going to have you direct this. And I'm going to have you use this here, Dr. Murray, and I'll be here. All right? You're talking to the audience now. Are we on CNN or Hello Tennessee Morning Show?
CNN, MSNBC.
MSNBC.
Yes. Doctor.
Murray.
Dr. Murray is here to talk to us a little bit about full practice authority in the state of Tennessee. I understand you don't have that. Why is that important for our viewers?
Full practice authority is important for our viewers and for the patients in Tennessee, because nurse practitioners' hands are tied when it comes to taking care of our patients 100% and completely. Right now, we we have what we call supervisor collaborative practice with the physicians. But we see patients all day. Oftentimes we see patients who are underinsured or not insured. These are patients who the physicians have decided that they do not want to bring into their practice. We see a lot of patients with diabetic complications, hypertension, and one of the things that we are not able to do is we cannot order diabetic shoes, which is something that is very simple and our patients need. Sometimes we're not allowed to order home health services inside for our patients who are in desperate need.
So Dr. Murray, it sounds like if nurse practitioners had full practice authority, that people could get the care they need a lot quicker. Is that what you're saying?
They could get it a lot quicker without a lot of complications that arise once patients come home. I had this patient one time that I sent from the hospital, and I had ordered oxygen on the patient, and my provider was in total agreement. He had left everything up for me to take care of. Well, I sent this patient home, and guess what? The patient was sent back into the hospital within 3 hours because the physician neglected to co-sign the order behind me, and the ambulance service would not leave the oxygen for the patient. The patient had to be brought back to the hospital for another overnight stay. These are things that are very simple, they make no sense.
So that's an alarming story. Did you connect with that story? Yes. That story is true.
It's true.
It's true, and it happens all the time. It's true. It's true, and it happens thousands of times every day in this great state of Tennessee. So what do you want, Dr. Murray?
We're not trying to compete with the physicians. We want to work with the physicians, but ultimately, it's all about the patients. It's all about the citizens of Tennessee. That they get the best care possible, and they don't have to drive 50 or 60 miles to get that care. We are willing to take care of the underinsured and the uninsured, but we also are capable of giving quality care to people with full insurance in every aspect. We know how to collaborate. We know how to consult. What we don't need is a collaboration. We already have a consultative profession with the physicians. Just like a family practice physician, we know when we need to consult to a specialty service. That is all we ask, is for our practice not to be crippled by rules and regulations that make no sense.
I like that. That was great. Also, amazing. Very put together, loving the jacket. But wait a second. What do you, did you hear a soundbite?
Yes.
What?
Makes no sense.
Makes no sense. Memorable soundbite. That was awesome. And the real story. And it makes me, if I'm a legislator, thank you, Dr. Murray, it makes me want to work on this. Right? So remember, she connected with you with the real patient story. She left you with a memorable soundbite. It makes no sense. Now, what you would do, and this was off the cuff. This is off the cuff. You would take all of that, you write it down, you write it all down. You don't edit yourself. You write everything you can when you're trying to make a point. I do this, write everything down, then you go back and you go, wait a minute, I gotta make this concise. I've gotta make it short, short, short. Remember, it's an elevator pitch, right? So you're trying to take all those pithy statements and all that information and boil it down to the essence so that what do people remember? It makes no sense. I have a patient who was sent right back to the hospital because the physician forgot to co-sign an order. It's tragic. This happens to people all over Tennessee every day. This costs all of us as taxpayers millions of dollars, and there's no need because the doctors want this, nurse practitioners want this, and we want the legislators to want it as well. So that's how you would do something like what Dr. Murray did, and you distill it down. I did one before I came here, and we have to go. But basically, hook them with a story, and lead with the conclusion. Right? 5,000 kids in Memphis can't get medication they need. You know, get the facts, get a story. I saw a patient the other day. Her mother had to choose between food and medicine. That's a choice no mother should make. That's a great soundbite, right? When you want something, cook them. Why should the people care? What's in it for them? And a call to action. So we talked about flagging. My call to action, if you have not followed me on Twitter yet, please. Again, I want to thank you. This has been an incredible honor for me. And I've really enjoyed meeting a lot of you. I hope this is helpful. And I just want to thank again Dr. Wendy Lights, Dr. Tommy Norris, Dr. Diane Todd Case, Dr. Murray, and everyone else who attended. And thank you very much. All right, any questions before you run out for pizza? Yes. How do you address the question, why didn't you just become a doctor? This is how you do it. Ready? I love being a nurse. I would never change it for anything. As a nurse, I get to combine caring, compassion, and my education. How's that? When you answer a question, you don't have to answer the direct question. You answer the question you want to answer. You see this on TV. Other questions? There's got to be, okay, one more. Come on, we got to have one more question. One more. Over here. Somebody, please raise your hand. Oh, thank you. In my wildest dreams, where do I see nursing in 10 years? I think we're going to have a much bigger place at the table. And when I say table, I mean health and human services. I mean in legislative bodies across the U.S. I mean that nurses are already running a lot of hospital systems. Nurses and nurse practitioners are already running a lot. So I see us having an even bigger role, and what I really see is not explaining ourselves as much. Because in a few years, there will be more of us, more DNPs and more nurse practitioners than there are family practice doctors. And let me leave you with one important statistic. Not only are nurses more trusted, we are the most trusted, but when it comes to patient satisfaction, we lead our physician colleagues. We lead our physician colleagues, and our outcomes are the same or better. So at some point, we will not be explaining ourselves as much. And I also want to tell you, sometimes in some hospital systems, nurse practitioners make more than physicians. If you're a family practice doc and you are competing with a hospitalist NP who does first assist in neurosurgery, that NP is making more money. So I am telling you that people are recognizing this. Pharmaceutical companies recognize that not only do patients take our prescription, but they fill it and then they refill it. Why is that? They trust us, but we've already said to them, I'm giving you a menu of options. And you go, well, I think I'll use this one. And I've answered all your questions, and I've said, oh, here's the side effects you might experience. I've given you anticipatory guidance. So they don't freak out when they have breakthrough bleed. Well, she told me that was going to happen. When you give somebody a triptan and you say to them, you know, you're going to get a little tingly feeling and your heart might race a little bit, that means it's working. Then they're not going to go, I can't take this, it gives me heart palpitations. If you give anticipatory guidance, they take the medication. Oh, that means it's working. Any other questions before I let you go?
For us that are like day two,
Day two.
what would be your best piece of advice that you could give us going forward?
Thank you. That's a beautiful question. Today's day 2, and you're moving forward in your career. It really is the 2 ears. It's the 1 mouth. Listen twice as much as you talk. If you listen, you will really get to know your patients. Also, when you're talking talking about difficult subjects, and it's going to happen in your career, find the people who do it well and shadow them or ask them what their scripts are. Maybe, Diane, we could do a thing like that. If you have to tell somebody that they've had a miscarriage, that they have cancer, that they have a chronic disease, learn how to give bad news with love and kindness and compassion so you don't make it worse for that person. So listen with your 2 ears, talk with your 1 mouth, and learn how to give bad news in a beautifully loving, kind, compassionate way. And I'll tell you, I'll give you this hint. When I'm doing an ultrasound, what I say is, what I'd like to see is this. I'm not seeing that. I'm concerned because I'm not seeing that. So I start with, what we'd like to see is this. I'm not seeing that. Unfortunately, I'm not seeing that. Now, that makes me concerned that this is what's happening. Can I do one more?
Yes.
Third thing, learn how to ask about sexual assault.
Yeah.
Here's a way to ask about sexual assault. You might say something like this, especially if you notice body language. If somebody's like, oh, I'm dead from the waist down, or they're gripped in their seat, and they're really afraid. You might, or you're doing an exam and they get kind of fidgety when you touch their breasts. Or just in an interview, you might say, many of my patients who say that or who get uncomfortable with these kinds of exams have had a negative sexual experience. Has that been true for you? So you normalize it. Many women have experienced this. Has that been true for you? If they disclose, you have got to, the first thing out of your mouth is, I'm so sorry that happened to you. I'm so sorry that happened to you. Even if you feel overwhelmed, acknowledge it. Men also get sexually assaulted. And so that's another question, another way to say it. Many men are hesitant to talk about this very personal subject. Have you had a negative sexual experience? Has that been true for you? And then just say you're sorry that was their experience, because then they feel heard. I cannot tell you the number of people who have disclosed to me that they've been sexually assaulted, and as we got to talk later on, they had been asked before, but the person shut down who asked them, and they said, oh, I can't talk to them about that. They're not open to this. So, thank you again. I appreciate your time, and I hope to see you again. Thank you.
I want to respond to what she did more with patients, but let me tell you, when your colleague, Sarah Wilkinson, who's the president of the SGA, also kind of asked me that question. And so one of my responses to you also on day 2, find a mentor. When I was just finishing my PhD, I was at a conference and somebody had a PowerPoint slide, and it was a turtle sitting on a fence, and I had never forgot that because I did my PhD in 1998. And there was a turtle sitting on the fence, and the caption underneath it was, if you ever see a turtle sitting on a fence, know it didn't get there by itself. And so that stayed with me all of these years. So I guess one thing that I would say to all of you as students, find somebody. Know that I didn't get there, all those degrees and all the awards, and of course I'll say that my most favorite title and my most favorite award is being Nana. That's my most favorite, but all the things that I've achieved in my career, I didn't get there by myself. So I would tell every one of you, find a mentor. Find somebody that can help you through your career as a student, and then when you finish as a student, find something that you want to do, and say, how did you get there? How can you help me? Because you can't get there by yourself. No man is an island. That's been a long-term statement. Find somebody that can get there and that can help encourage you, saying, I'm really excited that there's 3 of you probably here. There's 3 of you that got awards from NAMS, the North American Menopause Society. When I started my PhD, I had a mentor here at UT and said, Diane, come with me to the North American Menopause Society. And so I went there.